Good morning, everyone. My name is Robert Hersey. Happy Wednesday to each of you, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled Understanding the Impact of Stimulant Use Disorder. This webinar is being made available through a collaboration of the Florida Department of Children and Families and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and are only able to view your name. Your webcam and microphone have been disabled. If you have questions, please send them to the presenters and myself, the host, FATA Webinars, by using the chat panel. The button to open the panel is usually located on the upper right side of your monitor. Please use the chat panel to send any questions you may have as you think of them. The presenters will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio at any time during today's presentation, there are a few options to try using the Communicate menu. One of these options is on the screen now, and all options are posted in the chat panel as well. After ensuring that your volume, both on your computer and speakers, if applicable, is not lowered, you may click the Communicate menu, then click the Audio Connection panel. Click Disconnect, follow the first two steps again, and click Call in using computer and follow the instructions on the screen. If you continue to experience poor audio through your computer, try using the I will call in option under the Communicate menu. The access code and event password are on your screen and in the chat panel. Please note that calling into this webinar is an alternative to audio and is not a substitute for viewing the webinar on a computer or a mobile device. You must be connected to the audio of this presentation as well as view it on screen to receive a certificate of attendance. We are unable to verify attendance if you call into the webinar but are not connected to WebEx via your computer or mobile device. Therefore, audio-only attendees will not be eligible for a certificate of attendance or CEUs. The recording and materials used in today's presentation will be available on the FATA website within 30 business days. To access the recording in PowerPoint, visit www.fata.org, navigate to the Resource Center, and click on Training Library as shown on the screen. FATA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on the FATA website. You will first need to register or sign into your account to complete the evaluation. Please ensure your name and email address match your webinar attendance. Information you provide FATA as part of registering remains confidential. Statements of credit will be posted within 30 business days after the evaluation closes in individual professional development journals for persons completing the evaluation and attending the entire webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Please note that the evaluation will close at the end of the day on Monday, November 13th, 2023. Up to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license numbers for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside the state of Florida, you do not need to provide your certification number when you register with our site. Please note that WebEx monitors arrival and departure of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar and we are not permitted to provide partial CE credit. Lastly, we encourage you to complete the survey as soon as possible. If you experience technical difficulties accessing the survey, please fill out a contact form at www.fada.org or email training@floridabha.org before the evaluation closes on Monday the 13th. This presentation is intended solely for educational purposes. The views, opinions, information, and content expressed in the presentation are those of the presenters and do not necessarily reflect the views, opinions, or policies of the state of Florida, the Florida Department of Children and Families, the Florida Alcohol and Drug Abuse Association, or the Florida Behavioral Health Association. Attendees should note that sessions are recorded and published in various media. Now to introduce our speakers for this morning. Our first presenter is Kathleen Roberts. Kathleen Roberts, Chief Executive Officer for the Community Coalition Alliance, has more than 15 years of experience in behavioral health at the local, regional, and state levels. In her role at CCA, she works with community coalitions, providers, and partners to assess substance use trends through data collection and analysis, conduct research, partner engagements, capacity building, and community assessments. Ms. Roberts also provides ongoing technical assistance and training and serves as a master trainer for Florida with the Substance Abuse Prevention Skills Training curriculum supported by the Substance Abuse and Mental Health Services Administration. Prior to joining CCA, she worked at the Florida Department of Children and Families Office of Substance Abuse and Mental Health, serving as the clinical team lead, Florida's National Prevention Network designee, and the State Epidemiology Work Group lead. She received her Master of Science in Criminology from Florida State University and a Master of Science in Criminal Justice from the University of Central Florida. Ms. Roberts is also joined by Major Michael Coy. Major Michael Coy is the Drug Demand Reduction Outreach State Prevention Coordinator for the Florida National Guard Counter Drug Program. Major Coy has been in the National Guard for over 17 years. His current efforts involve drug prevention, community outreach, a public awareness campaign, and creating an environment of statewide partnership in regard to cross-jurisdiction cooperation, information sharing, and communal response. His direct and indirect support has led to the collection of approximately 73,000 pounds of prescription medication in the state of Florida, in collaboration with the Drug Enforcement Agency, law enforcement agencies, and community-based organizations. He and his team were also responsible for presenting the Florida National Guard Drug Prevention Program to over 96,000 elementary, middle, and high school students across the state of Florida. And now, Major Coy, I will turn it over to you to start today's presentation.
Awesome. Thank you so much. That introduction is always a little bit, it sounds cooler than I think I actually am. So I appreciate that. Thank you so much. Appreciate you having us on today. We'll go ahead and get started here. So just a quick background. So the Florida National Guard Counter Drug Program, we've been working with the Community Coalition Alliance since we kind of kicked off our drug demand reduction outreach program about 7 years ago. Been working with Kathleen and her team. So we're super excited to be here today to chat with you all. As he introduced, I am the DDRO State Prevention Coordinator. I run a team of 10 across the entire state, which I'll talk a little bit more about in an upcoming slide. Before we get into that, I want to just give a quick overview of the counter drug mission and why we're here doing what we're doing. One of the first questions I usually get asked, typically, because it's the military and we're the Florida National Guard, and what do we have to do with drugs? And so I like to kind of start with just an overall mission of why we're here and why there is a counter drug problem, or I'm sorry, why there is a counter drug mission that we have here in our state. So if you go back and you think about really what is the National Guard responsible for, we're responsible for keeping Florida citizens safe. So whether that be a natural disaster, a hurricane, fires, any kind of state level problems that you can think of, the National Guard is usually activated to go out and assist law enforcement, nonprofit coalitions, different organizations throughout the state to help respond to whatever that disaster might be. Well, over 20 years ago, it was kind of a meeting of the minds, and they said, "Hey, well, we have this drug problem that we have it's not just at the state level; it's at the national level. So, how about we use these National Guard experts that are already working in communities that are already have relationships established, and let's use them to help with some of the drug issues that we have across the nation." So that's when the counter drug program was kind of created about 20 years ago. So here in Florida, and each state is a little different the way they're set up. Here in Florida, we're broken down into a couple of different what we call functional areas, and I'm going to spend the majority of my time talking about prevention stuff. But I think it's important for everybody on this call, on this presentation today, to understand the different capabilities that we have to kind of go out and share with law enforcement agencies, with nonprofit organizations, some of the things that the Guard can bring to the table. So of course, we have our headquarters. Every good military unit has their higher headquarters that kind of do all our admin and purchasing and stuff like that. But then we have some things that get into a little bit more detail. Our mission 2, that's our technical support, where we work directly with law enforcement agencies. We can provide linguistic support. We can provide investigative support, different communication and engineering support. And then we have a training center out at Camp Blanding Joint Training Center near Stark, Florida, where we have different law enforcement agencies at the local, state, and even federal level that can come and train at our facility. And then we have our Mission 5, our reconnaissance teams that can help law enforcement agencies provide aerial, marine, ground reconnaissance whenever they're going out and doing anything related to drug activity or having that drug nexus. And then you've got my team. My team is right there on the far right. It's Mission 6, and that is the Drug Demand Reduction Outreach Team. So we work directly with drug prevention coalitions, task forces, all the way down from the local level to the state level to some organizations we work with at the national level. Here's our mission statement. Our mission is, our mission is to provide that strong response to substance misuse, to achieve reduction and prevention of widespread misuse for illegal substances throughout our state. So our main mission is to work with organizations, kind of be that force multiplier, and be of any assistance we can for drug prevention activities. A couple of our objectives there, like I said, becoming that force multiplier and reduce the demand for drugs across our state. Here's kind of how we're broken up. You can see the different colors that kind of break down where we are at across the state. I have an operations officer that helps me run all of our prevention operations up here in North Florida, and then my team that is spread out across North, Central, and South Florida. And I will be my contact information will be shared, and I can get anybody on the call in contact with any of those in any of my team that would like additional information or additional assistance for prevention activities. All right, now Kathleen's going to give a brief overview of the Community Coalition Alliance.
Awesome. Thank you so much, Major Coy. We are so excited to be able to continue to collaborate with the Florida National Guard DDRO program and the team. Without them, it's would be very difficult to do the amazing things that we've been able to do in prevention. So I am Kathleen Roberts. I'm the CEO for Community Coalition Alliance. We are a coalition of coalitions. We serve as that collective voice of bringing all of those various groups together to work towards the health and wellness of all Floridians. By bringing in everyone together from all the different areas, we're able to look at what are some of the issues going on at that local level, in rural communities, urban communities, looking at different barriers and challenges, and then also at the same time, allowing that to be our opportunity to find ways to leverage efforts, ideas, and opportunities. Our vision is that of seeing communities working together to provide Floridians a healthy and safe environment in which they can thrive. Key to all of this is working across our various partners like the Florida National Guard. We work in that space of collaboration and making sure that we're committed to the needs of the local community at the regional level and then at the state by identifying the current needs through the data that's available and looking at what the research shows us as to be the latest and greatest innovation to be able to bring awareness and education related to substance use and all of those other indicators that relate to that as well. Through our organization, we are able to provide this forum of partnership by bringing folks together. We offer a membership to our alliance that includes community coalitions as well as other community partners. We have that opportunity to be able to network with one another, be able to discuss those barriers and challenges. Fortunately, we're also able to offer funding and oversight to many of our members across the Northeast region. We're working to find ways to also find some of that same support in our other regions as well. In addition to that, key to what we see will be the success for the work that we do is to ensure that there's constant workforce capacity happening. And so we provide a lot of training and technical assistance, both for the subject around behavioral health, but then also some of the skill sets necessary to be able to implement different strategies to be able to enhance the data collection process and to be able to really implement the work that we do in a more effective and efficient manner. And then the last thing that we do is really be able to have that partnership engagement to be able to find ways that we could really make that larger impact across our states. And that partnership is to bring in individuals or organizations that have access to data or information, access to resources, connections to individuals that help to spread the importance of this work that we're doing across our area, and really to be able to ensure that we're working across our entire state to address the issues that we are facing when it comes to substance use and many of those other indicators that relate. So we're excited to be here today to be able to share with all of you a little bit more information about what we're seeing when it comes to stimulants and what those things are. So with that, Major Coy, I'm going to turn it over to you to get us kicked off on our conversation here today.
Awesome. Thanks, Kathleen. Always an honor to do a presentation with you. So yeah, the title of today's presentation is Understanding the Impact of the Stimulant Use Disorder. A couple of things that we're going to go over today. We're going to start out with defining stimulants. Then we're going to go into kind of how to recognize those signs of stimulant intoxication, overamping, and stimulant withdrawal. Then we'll talk a little bit about some of the risks associated with stimulant use. And then we'll wrap up with some evidence-based approaches that can be used to address stimulant use in our communities. So to get us started, I kind of want to see where we're at and what our knowledge base kind of is on stimulants. So I want to bring up a question real quick. If we could bring up the first poll question. Which medications listed below are stimulants? Go ahead and check all that apply and hit submit. You got about a minute and 30 seconds to complete this.
Just remember, we're not looking for all the right answers. This is a start off before we get into conversations, but it helps us to understand what is the current understanding around this topic for those that are here in the audience today.
All right, so Major Coy, Miss Roberts, I am sharing the poll results with attendees now. I'm not sure if you can see them, but it looks like for the first option, Ritalin, 56% of respondees agreed that was a stimulant. For Xanax, it was 13%. For Adderall, it was 58%. For hydrocodone, it was 7%. And then for Adipex P, it was 22%.
Okay, awesome. And we'll go into a little bit more detail about the correct answers here in just a second. Got one more poll question. If we can throw that one up there again, no wrong answers. That's what we're here for today to kind of talk about these things. So if we can throw that other poll question up. And this one's just asking which substances below do you think are stimulants, and also go ahead and check all that apply.
And we see some folks are not responding quite yet, but don't worry about finding the right answer. This is just our opportunity to kind of gauge where we are at the start of this conversation. That way we can include some additional information as we move through the slides.
And again, out of about 150 responses, it looks like 60% of those individuals agreed that methamphetamine is a stimulant. 39% agreed that bath salts are a stimulant. For PCP, we had 34%, marijuana 7%, and cocaine 58%.
Okay, awesome. So that kind of gives us a starting point, kind of a heads up on where we're at. Just to go back over the answers for these, the medications, the medicines that are considered stimulants from that first poll question, that's going to be your Ritalin, your Adderall, and your Adipex. And then for the substances that are considered stimulants, that's going to be your methamphetamine, your bath salts, and your cocaine. And we'll talk about that and as we go through the next couple of slides. The first question that we're going to talk about today: what exactly is a stimulant? How do we define what that is? And that's going to be defined as one of those classes of psychoactive drugs that they increase the activity in the brain. It impacts your alertness, your mood. It excites the functional activity in the central nervous system, and it really speeds up the body's system. So it's your body's kind of operating on a hyperdrive. And one of the things that's important to note is stimulants are actually found in legal and illegal substances. We'll talk about some of those here on the next slide. So different classifications of stimulants. So one that we're all, some of these we're pretty familiar with. Obviously, caffeine. I'm sure we have quite a few coffee drinkers in the room. Anybody that works out, pre-workout, different caffeines, and a lot of different things that we ingest. Nicotine products. And then some of the illegal things, lots of coffee. Some of the illegal things: cocaine, methamphetamine, and then there are also some prescription stimulants based off different prescriptions out there that can factor in for Sorry, I was breaking up there for a second. So the commonality between all of these different classifications of stimulants is that they can all have the capability of being highly addictive. They all can cause potentially negative effects and significantly impact overall health and wellness. So some of the things we're pretty familiar with, different foods that have caffeine in it, chocolate, drinks, coffee, tea, energy drinks, soft drinks, and then also there are some of the over-the-counter prescription medications that also contain caffeine. The key point here is that consuming too much, like anything in life, consuming too much can increase the feelings of anxiety, dizziness, increase the heart rate, and also cause insomnia from consuming too much caffeine.
And just to add a little too for that over-the-counter medications, that's something that we've seen a lot of movement in our states and across the country for ways to really bring attention to this. So we know there's quite a few medications that have the stimulants with them, and so those are things like with the pseudoephedrine, ephedrine, all of those things. And what is it? What is one of the things that we're seeing now with those kinds of medications? If you can put into the chat, what do you notice about medications that include those types of, and these are the over-the-counter medications in the pharmacies? Looks like, oh, there's a chat. Well, one of the things that we're seeing now with medications that include those kinds of ingredients is that they're no longer found readily available down the aisles. Those are the ones, exactly. They're the ones that now have limitations as to how much you can purchase. They're the ones that require the signature to be in there. They're the ones that you can't just easily go in and grab and exit. They also have age restrictions associated with them. And so as a part of the Combat Methamphetamine Epidemic Act of 2005, that became a key requirement that these types of over-the-counter medications would have to be stored behind the counter and regulated by the sellers that were going to offer them up in their establishments. So with these establishments also had to put in place written and electronic forms to log the sales of each one of those products and ensure that the identification was viewed, reviewed, and it was in line with whatever additional guidance was put out there. So we know there has been movement in some of this. So I just wanted to bring that piece up for you all as we talk about some of these stimulants. They're not just things that we hear about with the street drugs, but they're also included in many other forms.
Yep, absolutely. And then talking about now being highly monitored, and some of those good comments there in the chat. We've seen a lot of progress over the years, the last couple of years, in the changes to some of the nicotine requirements. Obviously, that age increasing from 18 to 21 to try to regulate that a little bit closer, and some of the additional requirements that they're putting on the way that nicotine products are advertised, the way that the colors are on them, and the flavors. That's been a lot of in your face in the news over the last couple of months. The nicotine products such as cigarettes, pipe tobacco, cigars, the different snuffs, and then of course e-cigarettes and the vapes that we've seen that were very in your face advertising towards some of the youth across our country. And consuming too much of nicotine, you can see here, it can lead to nicotine poisoning, feelings of confusion, seizures, fast breathing, or even possibly stopping breathing altogether, and potentially even death with nicotine poisoning here. So it's great that we've seen some of that progress to regulate this a little bit better and increase that age. Then, of course, a lot of us have probably heard about this before. It's pretty wide known of the impacts of cocaine and how it can stimulate the brain. It's made from the cocoa tree, and it significantly increases that dopamine release in the brain and impacts those neurotransmitters that play a critical role in the reward and movement control of the brain. So obviously, cocaine, it does come in various forms. It comes in the powder cocaine that can be snorted, dissolved powder to inject into the bloodstream, and then it has a combination with other different substances, which we'll talk about a little bit more towards the end. Some of the other things that we're seeing in cocaine, with that being fentanyl and all kinds of other substances being combined with cocaine. And then smoking cocaine that has been that's when once it's been processed by the rock crystal itself. Some of the short-term impacts of cocaine, obviously it can in the immediate impacts, it can lead to extreme happiness, energy, makes someone feel good. It kind of can cause them to try to chase that similar high. It can lead to mental alertness, hypersensitivity to sight, sound, and touch. It can also lead to irritability and paranoia. One of the things that whenever I go out and talk to youth in schools about cocaine and stimulants is that unfortunately it does have some of the immediate positive things that kind of make someone feel good, but the long-term results of what it does to your brain, what it does to your body, what it can do to your life, can have significant long-term impacts. So while it might feel good in the immediate future, it can really cause a lifelong of issues. Some of the long-term effects here from cocaine use. Obviously, if it's being snorted, it can lead to loss of smell, nosebleeds, it even lead to problems with swallowing as it's ingested down into the nasal cavity, down to the throat. And then smoking, some long-term effects of smoking, it get extreme cough, asthma, respiratory distress, and it can also lead to the higher risks of infections like pneumonia. If it's consumed by mouth, it can lead to severe bowel decay because it impacts the blood flow in the body. And then needle injection, it can lead to those higher risks of contracting HIV, hepatitis C, and some of those other bloodborne diseases, skin and soft tissue infections. It can also lead to scarring, collapsed veins, and other negative health impacts. Methamphetamine, something here that you'll see that's very interesting on this slide is for the most part, these different molecules look pretty similar, but it's slight variations that change the different form. So here at the top left, you'll see an amphetamine, and top right, the methamphetamine, and then the MDA down in the bottom left, and then bottom right, the MDMA. Comes in different forms. You've got powder, pills, a sticky base, and then also the crystalline shards that are used. And as I talked about just a moment ago, it can significantly increases the amount of that natural dopamine that your brain is already capable of making. It's increasing that, which leads to chasing that feeling to try to get replicate that same dopamine release in the brain. Some of the short-term effects of methamphetamine use, it increases blood pressure, body temperature. It can lead to rapid or irregular heartbeats. It can really increase the wakefulness, physical activity. It does decrease appetite, and can also lead to faster breathing. So you'll see people that have challenges with methamphetamine use. These are some of those really the short-term things that you'll see in the long term. Next slide, please. And then some of the long-term effects, it can lead to extreme weight loss. It can lead to severe dental issues, anxiety, literal chemical changes in the way that your brain is structured and the way that it functions, confusion, memory loss, paranoia. You can see that these are all very negative long-term effects from using methamphetamine. Then we have prescription stimulants. Those are the ones that can be received from a doctor, from a pharmacy. Those prescription stimulants, they're used in various different formats, typically to increase alertness, energy, speed up those mental and physical processes that create the enhanced focus. It's used in conditions to treat for ADHD and also in narcolepsy.
And the other piece we forgot to add on here is the appetite control. So you notice in one of the poll questions, you had one of the options to select the Apidex. So that you see a lot, because with that medication, what it does is it does reduce that appetite and it increases that energy, therefore, in hopes that that will help with the weight loss reduction. So that's one of the other things to look at for some of these prescriptions, is there's a variety of different uses that they do have.
Yeah, absolutely. And if you see, so this is that next slide, which kind of what Kathleen was just talking about. So these are some of the more common prescription stimulants that are out there, and they work by enhancing those effects of the dopamine and the norepinephrine. Some of those medications are Ritalin, Adderall, Dexedrine, things that are again used to treat ADHD. Some of those different. Next slide. Thanks. The terminology, the overdose description for the stimulants. So try not to use we try not to use the term overdose when we're talking about stimulants, just because overdose is typically used is a typical terminology whenever we're talking about an opioid overdose. So for the terminology when we're talking about stimulants is going to be a stimulant toxicity or overramping. So the stimulant toxicity is the condition from the actual intoxication itself. And then overamping is the term that's used in place of an overdose and it's really used to describe the negative effect from using the stimulant. So it could be a couple of those different signs are rapid onset or elevated heart rate, incontinence, audiovisual hallucinations. It could even lead to unconsciousness and ultimately cardiac arrest or seizures.
And one of the reasons why we bring this up as far as thinking about terminology is with the rise of the opioid epidemic and the opioid crisis that was announced for our state back in 2017, the increase in awareness about what overdoses are has really been tied to the opioids and what that looks like, and the similarities across what those overdoses look like when excess has been consumed and gets to the point of to almost lethal. The difference for the stimulants, however, is that the overdose, which is the excessive amounts that is having the counter negative effect in your system, looks different depending on the individual, depending on the type of stimulant. So it's very challenging to say that there's just one type of response that you'll see that is the overdose. So with overdose, they have both the physical types of conditions that happen, but then there's also on the emotional, mental side as well. So there isn't a one style example of what that overdose looks like. So because of that, the field has started to really evolve in the terminology being used. And one of the newer terms that we are using more of is the overamping, as a way to really identify some of these different types of things that are happening. It's not the same as like the opioid overdose, whether it's the codeine, the morphine, the fentanyl. The overdose is the respiratory distress, somebody looking like they're just out cold, passing out, versus with stimulants, you can have a variety of different negative effects that result from the stimulant use. So it's makes this a little bit more of an understanding about what's happening and the different things that could happen to allow for that conversation.
Awesome. Thank you, Kathleen. This goes into a little bit more detail about what stimulant overamping is, and then it's basically experiencing the effects of the stimulants that have been so severe that the health and safety of the person that's using it could significantly be at risk. Then it's important to understand too that not all stimulant overdoses look the same, and we'll talk about that in a little bit on some of the other things like we said earlier that have been added into stimulants and some of the ways to prevent a stimulant overdose or an overamping. And they may significantly vary, even if they're not fatal. Medical attention may still be necessary in that situation. And as Kathleen said just a second ago, that overamping does have physical and psychological effects. Here's some signs and symptoms of an overamp from stimulant use. So some of the physical things that you could see: dilated pupils, looking a lot larger than normal, dizziness, tremors, nausea, vomiting, overheating, or excessive sweating, possible an increase in blood pressure or hypertension, pain in the chest or tightness, rapid breathing, fast heart rate, arrhythmias. Those are some of the physical symptoms and signs that you could see. And then some of the psychological signs, they could be experiencing restlessness, irritability, confusion, different mood swings, extreme panic, anxiety, and then hallucinations and even psychosis. It's important to understand that there may be a mixture of both the physical and the psychological symptoms that you're seeing. And then obviously signs of a lethal overdose or overamp. Obviously, immediately get in contact with rescue 911 and get someone on the scene. Some of those effects are it's significant increase in blood pressure, heart rate's rising, possible heart attack, that body temperature is rising rapidly, and then issues with breathing, and as I said just a second ago, even causing seizures or strokes. And responding to a stimulant overdose or an overamp, while you're waiting, if there is any kind of overheating, it's going to be important to try to get that person to bring that body temperature back down. So whether that's using ice packs or any kind of wet cloths, anything cold, put it into the hot spots of the patient, knee, head, and try to. The goal is to try to bring that body temperature back down while you're waiting for rescue to respond. If there is a suspected seizure, it's important to turn that person on their side, put a pillow or a soft item under their head, and then you want to try to get them away from any other things that, if they are having a seizure, any other things that they could possibly bump into or hit their head on, and just try to keep them as comfortable as possible until rescue shows up. And then don't restrain them if they're having a seizure. Don't put anything in their mouth. Don't try to restrain them, because that could cause additional damage.
And the other thing too to understand here, so we talked a little bit about why we're using a little bit of a different terminology when we're talking about that overdose, and that is because we've seen so much education across our state and across the country about opioid overdose and providing Narcan and providing naloxone in whatever form or brand of the product itself to reverse that overdose. Now, the naloxone is intended to reverse opioid specific overdoses. So it doesn't do anything for stimulants. And what the danger about some of this is we start to see some of these articles come out saying, oh, well, naloxone doesn't work on cocaine or it doesn't work on methamphetamine, so don't use it. What we encourage is that always use it. There is no downside to using it for someone. It's not going to make their overdose worse. It's not going to do anything to them. But the reason we encourage that is because we don't necessarily know exactly what was all in the substance that was taken. And if somebody is presenting with respiratory distress and they're passed out, the chance of using the naloxone is in case there is any opioid mixture in the substance. This will at least help to reverse the opioid overdose of what's happening, to hopefully give enough time for first responders to arrive and be able to work with the person to get whatever other type of health support they need. So while naloxone does not work on the stimulant, we still encourage always use it, because you never know exactly what is in that. And we'll talk a little bit more about what we're seeing with fentanyl and why that matters for the discussion of stimulants here. But we really wanted to emphasize that when we get to this point, while there isn't a drug or medication like naloxone available for stimulant specific, we still encourage that if you see someone that looks like they're having respiratory distress and is passed out, to still go ahead and use it, because there's nothing that you're going to do to harm them by using that naloxone, but you could be saving that person's life, because there could be the chance that there is an opiate mixture in there. Like I said, we'll talk a little bit more about that fentanyl piece in a couple of slides coming up, but really wanted to emphasize that as we get through how do we respond to some of that.
Awesome. Thank you, Kathleen. Just to wrap up some of the risks that are associated with stimulant use. We've talked about most of these already. There's the increasing the feelings of anxiety, dizziness, fast heart rate, insomnia, feelings of confusion and memory loss, possible seizures, the increased risk of infections by using the injection, and then breathing complications, skin issues. It can impact the increased dental decay, and then hallucinations, paranoia, and could even lead to death if not if they don't receive medical care in a timely manner. I'm going to go ahead and turn it over to Kathleen, and she's going to talk for a little bit about what we're seeing here in Florida and some data specific to us.
Awesome. Thank you so much, Major Coy, and thank you for giving that foundational understanding of what we're talking about when we reference to stimulants and what kinds of substances from both the illicit and illicit ones to get an understanding of what exactly is out there. So we had a couple of comments put into the chat, and we're actually going to talk through some of those in the next few slides. But if we see something come through the chat and we're not addressing it quite yet, don't think we're ignoring it. There may be a better slide coming up to go with some of the comments that are put in here. And from what I see here, we will be actually talking about that here coming up shortly. So the next few slides, I'm going to cover some of the things that we're seeing here in our state. I love the work around data. It helps us to really understand more about what is going on. The more we understand what is going on, where it's happening, who is it happening to, and the why, then we can do a better job of figuring out what those resources are that we need to bring in. What are those different programs that we have to implement? What are the different supports that we have to put in place? And what kind of awareness and messaging has to be shared out there to help the public understand what issues the community is struggling with? The more awareness that we have about a situation, the better equipped we are to be able to handle it. So not everybody's a fan of the data, and I promise I won't make this very boring. I know some people are like, oh, yay, data slides and graphs and charts, but the bottom line of this is it tells a story of the picture of what we're working with. And if we understand what we're working with, we can do a better job of dealing with those issues. So I've got a couple of different data sources that we're going to be using here to give that picture about what we're seeing here in our state. But we did reference each one of them, and we have included a reference list at the end of this PowerPoint presentation that you all will have access to. So if you have questions about that, you'll have those available. And also, if you want to know a little bit more about some of these data, please feel free to reach out. We're happy to help translate some of the data. We're also happy to help show you where we pull some of this information from. So the first few slides here that we're going to talk about is what we've seen through the medical examiner's toxicology report. The nice part about these reports is that we do get them with some great explanations about what we're seeing as the state as a whole, but then also what we're seeing across the different districts in our state. While Florida is one state, we are split off by so many different variations across. We have rural communities, we have urban communities, we have areas that are on the coast, we have areas that are inland, we have areas that are crossing multiple interstate highways. So it's really important that we look at data as a state, but then also break it down to what do we see regionally, what do we see locally, because there is no one solution to everything. So we can't say this is the one thing we're going to do and it's going to fix everything in Florida, because we have so many different things that influence what's happening, and every community is a little bit different. So we have to have some of those context pieces to understand. So this first slide here, what we have here, this comes from the 2022 interim report. So this comes from the January to June data set from last year. We wish we could have the full data set, but you know, those data points take a little bit of time to be made available for everybody. So here we took a look at all the different substances that is screened through the toxicology reports. The top 3 substances, as you can see here, include cocaine, methamphetamine, and amphetamine. So we're looking at those stimulants related deaths. So as you can see in this chart here, we included both the cause and presence. So cause means that these were the ones that were notated by the toxicologist as the culprit for the death. Then the presence is that they were there, but maybe were not the cause of, and then the total. So as you see, cocaine is the top stimulant that we see on there, followed by that methamphetamine and amphetamine. This just gives you an understanding about what types of substances, so that helps us to then figure out what kind of awareness do we have to provide, education around some of these things. Also, looking at treatment options, what kinds of treatment options should we make sure are available, the latest and greatest research, if we know what are those types of substances that people are struggling with. So this is for our state, and those are the numbers, and then we've got the percentages of what that makes up. But as we think about what we see in the toxicology screening, and we had comments there come up in the chat about what are we doing to have the conversation about overdoses with stimulants and fentanyl. So that is a very great question to pose there, because that is a very serious concern and reality that we're seeing in our state as well as in the country. So taking a look at the same medical examiner report for the first part of 2022 from January to June, we see that we have about 3,050 deaths that involved fentanyl. So then we looked at those top 3 substances of stimulant substances that we mentioned in the previous slide. And of these that had fentanyl as the cause of death, 924 of them also included methamphetamine. 816 also included amphetamine. 1,163 also included cocaine. And really, we could go down the list of all of the other stimulant substances, and you can see there is such a huge percentage of individuals that passed away as a result of not just a stimulant and not just an opioid, but the combination of both of them. And that's something that we are seeing. One of the reasons that we are seeing that is because there is a lack of awareness of what exactly is included in the mixture of the substance. So whether it is in a pill form, a powder form, or any of the other forms that we discussed here earlier in the description what stimulants are, is that we're seeing a lot of inclusion of fentanyl in those different substances. So, and we are also hearing from the various hospital programs that they include to address overdoses, that individuals will come in and they'll say that, well, I didn't take any opioids. It was just cocaine. I use cocaine from time to time, or I don't touch opioids. I use methamphetamine, or whatever the case is. They are sincere in that, and that's because the fentanyl that has been added in is not something that they're always made aware is included in there. So we are seeing a lot of that. And that's why we are also encouraging, as we're talking about the overdoses and how to respond to an overdose, even if you know the individual is a cocaine user, or you knew that methamphetamine was involved, still we encourage the use of naloxone, because there are what we're seeing with the fentanyl is it is involved in so many of the other substances. When we think about the counterfeit pills, so those are the pills that are made to resemble other types of existing pills, especially for medications. The DEA's latest updates based on the seizures that they've had, out of every 10 counterfeit pill, the number is now 7 of those counterfeit pills had fentanyl, and enough fentanyl to be lethal. So it's really important for that conversation to happen, that whether it's individuals seeking Adderall, or if they're seeking diet medication, or if it's any other kind of prescription stimulant medication, if they are getting it not from a physician, not from a pharmacy, not from somewhere where it came from a legal place, it's really important to know that the dangers of that pill having fentanyl is extremely high. And so having those conversations is going to be really critical. And that's why we continue to encourage the use of naloxone. The other comment I see that we had here is somebody mentioning that the price of naloxone is high, at almost $50. So the $50 is actually a much better pricing than it used to be, so that's already there, a big piece. There is also Smart RX that allows you to get that price down even further down to, I think, into the 40s. But then what is also important to note, and I think somebody already put that in here, we are so fortunate that the Department of Children and Families has established their overdose prevention program with the department, that they are able to purchase naloxone at very large quantities and make that available to providers across the state for free, to be able to get that and get it out to the communities for everybody. So while there is definitely a price piece, there are so many ways that you can access that resource, and we encourage you, if you have not been to the isavefl.com, I believe it is. And Robert, if you could just verify the website, but the Department of Children and Families has a website that you can go to look at where the providers are across the state and where you can get the naloxone. If you are with a nonprofit organization and you have an interest in getting this for free, you can also reach out to the Department of Children and Families, to Jennifer Williams, and be able to enroll in that program. So I hope I answered the couple of comments that we had here related to that. And Robert, let me know if I missed any comments. I'm trying to address them as they match the slides that we're on. So I think we got those. All right. So again, the reason we keep bringing up this piece about the naloxone is because we are seeing such an increased mixture of fentanyl across all the different substances. And so while the naloxone is only going to address and reverse the fentanyl piece, at least that buys you enough time to get first responders to the scene to be able to provide the medical attention needed for the individuals. So the next few slides here, this is coming from the Frost system from the University of Florida. If you have not accessed that website in the past, I highly encourage that you do so. It is such a great way to look at what's going on in your community with a great visual. Like I said, not everybody's a fan of the data, so they don't want to see all the numbers, but something like this helps you to really look at what is going on in our communities across our state, across the various counties, and how does that change over time. So the two pictures that you see here, these are maps of the state of Florida, and these are the cocaine or psychostimulant drugs that were found in the toxicology reports for the deceased individuals. So I've included, this is 2017 that you see there on your left side, and then 2022 that you see there on your right side. What I like about this visual is it helps us to see how over time our communities can change so drastically. So as you can see, the different shadings that they have included here is that the closer you get to that really dark orange, that means the higher rates you have of these substances showing up in the toxicology reports. Oh, and I see one more piece here in the chat. So the difference between cause and present, so since we're still on the medical examiner type data, the cause is those are the substances that have been identified by the medical examiner as the reason that individual died, versus the present means that those substances were in the system based on the toxicology screening, but they were not associated as the substance that caused the death. So that's the difference between the two. And you can actually see in the medical examiner's report that sometimes they have more than one substance as a cause because they're so closely connected you can't differentiate which one was that final piece that caused the death of the individual. So I hope that helps to understand a little bit more. So here again, we're looking at the changes. So as I go through and move to the next piece here, you can see if we take a look, especially around that panhandle of Florida, looking at from Tallahassee all the way over, we see the change and shift in those communities. And then looking at the kind of Tampa area there on the coast, we see at 2017, there's very lighter on the rates of what we're seeing for cocaine and other psychostimulant drugs as a cause of death here in those medical examiner reports. But then over just a short amount of time, because that's not that much from 17 to 22, yet look at the drastic change that you can see in that area. We go from the gray to very light to a very dark orange, which is the much higher rate that you're seeing in there. So even though some may not really love the idea of looking at data and looking at the figures, looking at the charts, these types of visuals help you at least to have those aha moments with your communities and partners to say, look, our communities are changing and they're changing pretty rapidly. If we've gone from 2017 where we didn't really have a high concern and issue around cocaine and other psychostimulant drugs to where we are now, where it's one of the higher rates that we see here. So when you go to this particular website, it's really nice that as you click on this, you can actually hover on each one of the counties and it'll tell you that specific rates per 100,000 for the county of interest. And you can look at the county that you live in, you can look at the surrounding counties, and we always encourage looking at the counties around you because there's always a relationship. If the counties around you have higher rates and your county does not, that doesn't mean that you're in a safe bubble. It just means it just hasn't hit you yet. So these types of resources are great to get that understanding about what is going on here. So we have another question, is the data calculated every 5 years? No, this data you can actually look in there from year to year. So the medical examiner's toxicology reports, they issue those every year. Actually, it's kind of like twice in a year. So they have the interim report that comes out that covers from January to June, and then they have the annual report that gives you the whole year snapshot. Then that information, the University of Florida in their frost system is able to include that in their data, in their dashboard, so you can pull these great little snapshots and visuals. There's other neat things that you can do on there, but we just wanted to give a couple of examples of what you can see when you go on there. So yes, you can see it from year to year. It doesn't have to be 5-year increments. The next piece here, so again, like the previous one, we're looking at the frost system with UF, and these are for the methamphetamine drugs that were identified in the toxicology screening. So again, you can see a little bit of a difference between our state from 2017 to our state in 2022. So as we move to the circles, you can see some of those areas changing over time, where you can go from not much of an issue to quite a bit of an issue in such a short amount of time. And you can see some variation. So with the methamphetamine, we can see again with that kind of little panhandle area starting there, but then we've got more of that Volusia County area versus the slide before. We were talking more about closer to the Tampa area. So these types of data resources are fantastic because it helps you to see how those differences are. We are one state, Florida. However, we look very different across the different counties and across the different regions. And so the more we understand what those differences are, the better we can direct some of the resources that we have available, and the better we can inform the different types of marketing, messaging, and campaigns that we do to bring awareness around these issues. And also, it's really important to help the community understand what are the rising trends. For us working in this field, we kind of live and breathe this and are in the know on a regular basis because that is our focus. But for the everyday person, for the everyday parent, for the everyday community member, this is not what you focus on every day. So they need other groups like us to share this out, to understand these are issues that are coming to their communities. As we start to see the fentanyl being mixed in across the various substances, that became as a really critical point to say, we need to send this message out for all individuals to be aware that this is the new pattern and trend that we're seeing. So if we have that awareness and understanding, we can take more safety precautions to ensure that we're not seeing those overdoses and deaths and fatalities increasing over time. This is another type of graph you can pull from there. And Jennifer, yes, I too enjoy analyzing the data. For me, this is a lot of fun. But I do try to explain it in a way that even if you're not a fan of the data, this information is still helpful to you as you continue to do the work that you do. So looking at this is a different type of visual that shows us over time what this looks like. So these are the cause of death. So again, we talked about cause and we talked about presence. So these are the causes, the reason the individual died. So we've got cocaine and we've got methamphetamine. What you can see very clearly in these is that as time has gone on, looking back from 2009, we're definitely seeing these substances increasing. Since 2017, we've really been pushing the discussion and conversation that opioids, and yes, opioids continue to be a major impact in our community, but it's so critical that we don't forget that there are other substances as well out there that are really affecting our various communities. And these graphs right here are a clear indication of just how much things have changed over time and are increasing. Cocaine is not new. It has never gone away. It's just now starting to really resurface again. And we're seeing a lot of that mixture of cocaine and fentanyl together. So it's, as we see here, of course, 2023 is still small there because this is not the final year. This is just from the first half. So looking at January to June. But you can see as we go through year to year to year, just how much more, especially like methamphetamine, has increased over time. So just having these awareness, and you can see the peak that began there in 2021. Some of the reasons that we're seeing this has a lot of, based on some of the information that we've been looking at, has a lot to do with what happened in 2020. The pandemic really did a lot to our various communities that were outside of just COVID impact. Just that time period in not just Florida, but across our country created a lot of issues that people struggled with, including isolation. We saw increases in depression, anxiety, um, disconnect from support systems, uh, the stress levels going sky high for so many across. So all of those different factors kind of created like the perfect storm for some of these issues that we're seeing unfold now. And I honestly feel like we're going to continue to see those issues unfolding over time because of the impact that that's created. And it's an impact that we have not dealt with before because we never had our entire world in our lifetime shut down like that, the way that we saw back in March of 2020. When we were tracking the data at that time, we do a lot of month-to-month data tracking. We were seeing increases for like a 3-month period, like 60% increase in some of the overdoses in some of the communities that we looked at. So we continue to see some of that impact kind of continue to roll out as we try to understand the landscape of what is going on out in the field. So we bring this up just as an understanding of what's going on in the communities. The next couple of slides here, we pulled information from the National Survey on Drug Use and Health, NISDA. These are the sub-state estimates. So looking here, this is what we look like at the national level. These are questions that ask about perceptions of great risk from using cocaine once a month among individuals age 12 or older by state. So this is looking at that 18 to 19. So based on this, we can see that according to their findings, in Florida, more people age 12 and older have a perception of great risk from using cocaine once a month compared to the US. So that said, however, we still have a quarter of the respondents did not see this as great risk. So while it's good to see that we're at least a little bit better than the national, we still have a little bit of that other kind of data information here to say, okay, well, why do we have near a quarter of the respondents not saying that this is a great risk? So that just gives us the opportunity to maybe have some of the conversations of an increasing awareness about what those risks are and what does that look like and what does that look like over time. The next slide here is looking at cocaine use in the past year for individuals that are 12 and older. So looking at this, cocaine use is higher in the US compared to Florida. However, in our state, we are higher than compared to the southern region of what we're considered in the southern part. So comparing to the other states around us. So you can take a look at also that map right there. So we included the Florida, but then by different region or sections of where we can see the higher indicator use from the responders from the survey here. So things change over time. And while we have seen, some reductions, like I said, cocaine is not new, and we have had that as a major issue at the national and state level before, but we did start to see a decline in that over time. Then, as you see from the graph, the chart right here, you're starting to see a little bit of that uptick, which is exactly what we showed you on the medical examiner data. Again, this is a little bit older data, but that's sometimes what we have to look at. But it's good to know where we are as a state and how do we compare across the nation. This slide here takes a look at cocaine use in the past for Florida, looking at across the different age groups. So while it's important to look at the data and what's going on by the the consumption patterns, consequence patterns, and all of those, it's really important to also then break it down into what does it look like across different demographics, breaking it out by age, breaking it out by gender, ethnicity, race, and all of those to better understand how are those differences being seen across our communities. Looking at that, cocaine use is highest among people who are between the age of 18 to 25, based on this data. Now, some of that has started to change. We do see changes in the age demographics by some substances that happen over time, which is why looking at your data on a regular basis is really important to understand. The next set of slides comes from data that we pulled from the Florida Health Charts. This dashboard is a great way to look at some of the local level data so you can see what does your community and your county look like compared to others in other counties, and then also how does it compare to the states. There's so many different ways that you can look at the data through here as well, by the graphs, and they now also do maps on there, so you can look at that, tables, all different ways to better understand what's happening. So the next few slides, we're going to talk about some emergency department visits. We're going to talk about hospitalizations and then prescriptions. So we'll get started here with the first one. So taking a look here, so these are the non-fatal stimulant-involved overdose emergency department visits. So again, these are the ones that are coming in because of some of those different negative effects that we discussed earlier through the slides that Major Coy discussed here. And as we saw also with the medical examiner data, we're seeing the increase that's happening over time. So starting here from 2018 to where we were in 2021, you can see quite a bit of a jump for individuals coming through the emergency room for non-fatal stimulant-involved overdoses. So again, the overdoses, we want to start changing that conversation, but this is just the way that it is labeled in there. But we really want to start referencing it as overamping, just to help distinguish that is a little bit different than when we talk about the opioids. So we start to see the increases here, and we saw that there's been a 14.3% increase from 2021 compared to 2018. This here, again, is taking a look at the same information, but we're breaking it down. So in this image here, we are breaking it down by year, but then in this one, we're breaking it down not only by year, but also by quarter. Sometimes we like to look at the breakout within the year because there could be other reasons that may be influencing why we're seeing certain spikes during a year, whether it is as a result of the hurricane, natural disaster, events going on in a community, whatever it is. The more you can break down the information about what you're seeing, the better chance you have of understanding the why. And if we understand the why, we can do a lot more in putting in some of the safety guards in place, putting in additional resources, finding ways to connect to what is available for services, and also to increase the awareness campaigns out there as well. So looking at this, you can see exactly where that spike is. So we saw in the previous slide that over time from 18 to 21, we start to see that increase. And as we look at that year, you really see that increase happening, particularly in 2021, happening in quarter 2, much higher than any of the other points. And so as we identify some of these things, we can dig in a little deeper and say, okay, well, what exactly was going on at this time? What was happening? Are there also differences across the state? So this, we try to give you a full state snapshot just because we have individuals from all across Florida on here. But then once you know this, you can break it down by the different regions of our state and then by county to see where some of that spiking is coming from. But we can see that things are increasing since we saw what we saw in 2018. Looking here, this chart shows you kind of the proportion of all drug-related emergency department visits that involve stimulants. And you can see how it increased significantly from 2021 to from 2018 to 2021. This is nearly double that we are also seeing from 2020 just in that span of year. And again, 2020 is one of those very strange years that we keep bringing back up in so many conversation about how the impact of COVID really was beyond just the COVID itself, but all of the things that were happening as a result of the response to COVID. So the shelter in place, the everything moving virtual, the disconnects, the reduction in available services, the various restrictions that were put in place really started to have that impact. And when we looked at really all substances, we saw increases across every single one. There's a number of different surveys that were done during that time that found even for things like alcohol, that people were working from home and drinking during the work hours since everything was virtual. We saw increases of that for schools that were doing team meetings with students and seeing in the background as they're looking at their students' parents walking by with beverages and other things as well. So much was happening during that time that we are going to continue to see some of that impact happening. But this right here just is a great visualization that things can change pretty quickly. And with that, we need to make sure that we're looking at the latest and greatest research about what are the things that we can bring in and put for these supports, services, and resources. This chart here, again, we're still pulling information from the Florida charts. And again, these data points are actually coming from the Florida Agency for Healthcare Administration. So we wanted to make sure that every slide and data point that we mentioned here ties into where that data is coming from, so that if you have questions or you need to go back and find more information, you'll have exactly where those came from. So again, we're looking at this short period here from 18 to 21. These are the non-fatal overdose emergency department visits. So we're looking at the gray being for all substances, the orange being the opioids, and then the blue being the stimulants. Opioids continue to have that major impact, and that's what we're seeing. But that doesn't mean that we have to stop to just focus on that. We have to understand that really it's a polysubstance issue that we have going on. It's not, it very rarely it's just one substance. What we're seeing within the toxicology screenings and the emergency room visits is it's multiple substances. But stimulants had a 14.3% increase over time. Of course, the opioids had a much larger increase with 63.5%. But just noting that those increases are happening is really important in understanding what's going on in our area. This slide here, again, we're looking at the hospitalizations, non-fatal stimulant involved. This chart shows the count of hospitalizations. So what we're seeing over time, we first initially started to see the decrease in 2020, and part of that was also related to, well, a lot of hospitals had restrictions. Even just the physician's offices had restrictions. You couldn't even go in person because of what was happening for COVID. And then, you know, when things were being lifted, we started to see the uptick happen again in 2021. Looking here, so these are the stimulant involved non-fatal overdose hospitalizations. So we had talked about the emergency room visits, the first few slides, and these are the hospitalizations. So this is looking again from that 2018 to where we are in 2022, breaking it out by quarter. So as we saw with quarter two kind of being that peak point for the ED visits, we're seeing the same kind of peak happening for hospitalization. And as we were moving into 2022, we're seeing that increase again for these stimulants. And these are for the hospitalization. And this is a survey that we have here in the state of Florida. We're fortunate to have one of the longest standing surveys in place to gather information from youth at the middle school and high school level. These surveys are done every single year, though at the county level, the data is done every other year. In the survey, we have so many different questions that ask students about substance use, perception of risk, grades, risky behavior, all these different things. So we pulled out some information about students that indicated that they used prescription amphetamines without a doctor's notes. So they're using this in not the way as prescribed by a physician. So looking at the various counties here, again, it's color coded by what we're seeing, from green being either none or very little to where the red of concern. So you can see these little pockets going on. And if you recall the slides that we showed for the medical examiner data of where we're seeing some of the increases, you see where we talked about the Volusia area, we talked about here near the Panhandle area. So we see also with the youth responses some of the same kind of patterns emerging here as well. So this is breaking it out a little bit more. So pulling out from the youth survey as far back as, well, almost from the inception of the survey, what we see over time. So we did start to see, you know, kind of that the decrease over time, especially happening there from the 2012 going down, but then we start to see this uptick and notice the difference between female and male students. Female students are seeing a much larger increase and report a past 30-day use of prescription amphetamines without a doctor's order. Understanding kind of that difference as well helps us with some of that education and resource distribution and information and awareness to happen with the different communities. All of this information is also available down at the county level for all of you. You can go to the Department of Children and Families to find the reports that they have on their website for the state, and then the tables for each of the counties. But you can also look at the Florida charts data, that dashboard, and you can pull your information there for your county as well as for the state and create some of these nifty little graphs. But we definitely encourage everybody to always be looking at that data and to look at it often, because things do change over time, as you saw with the slides of how much we can change from such a short period, that we really need to make sure that we're constantly looking and noticing any upticks or trends or things like that across the board. So this one here, taking a look at breaking it down by ethnicity, so we can see what those differences are, and we can see the overall trends comparing non-Hispanic white to non-Hispanic black, and then Hispanic and Latino, and seeing kind of the differences there. One of the things that's really great about some of the partnerships that we've been able to have is we have a very strong partnership with the Florida HIDA, which is a high intensity drug trafficking area. If you are not connected with your region's HIDA, it is a great partnership for you all to reach out to. In our state, we're fortunate to have 3 HIDAs. We have the North Florida HIDA, the Central Florida HIDA, and the South Florida HIDA. They have access to information for law enforcement information, so the arrests. They also have access to the overdose map, where they can see real time where things are happening for the overdoses, and they can get a really good picture not only about the state, region, or county, but even more drilled down by the zip code level. So if you have not made that partnership, I highly encourage you to do so. They are fantastic to work with. The next few slides here, we're going to share a little bit about the Florida Poison Control. So Florida Poison Control has their dashboard as well, which is very easy to use and also provides fantastic information. They are the ones that can share out information about the number of calls that they get for a variety of different topics and issues. But on there, you can take a look and look at specifically some of the things. So this is looking at Florida Poison Control's dashboard for stimulant and street drugs, taking a look at what they're seeing from the calls that are coming in. They give you what are the top exposures, what's that age distribution, and then they also have those nifty little maps to help us really pinpoint where are some of the hotspots that are happening. Which is really helpful as we're thinking about where more information needs to go, where more resources need to go. So on this slide here, you can take a look at looking at the calls that are coming in related to stimulants and street drugs, that Miami-Dade is showing as one of the highest with the calls that are coming in. And interestingly enough, the calls that are coming in relate to those that are the 5-year-old range and then also the 13 to 19-year-old range. So when we think about who is being impacted by this, information like this is really critical. It helps us understand the who, but then it helps us also figure out, well, where does that information need to go to? That looks like a lot of education opportunities for parents and caregivers. Looks like a lot of great information to be able to share with school systems and organizations working with young people to be able to address what we're seeing at the data level. On here, these are for what we're seeing for amphetamines and related compounds. So these are the calls that they're getting related to that. Again, breaking it down by your age distribution and looking at the nifty little map there to identify hotspots. So based on the information here, we can see that the highest counties include Hillsborough, followed by Miami-Dade. And then again, looking at the age impact of the largest one as being that 13 to 19, and then the 5-year-olds and less. So great information on understanding what's going on across our state. Here we have for the calls that are coming in for the methamphetamine. So this is for 2022. These are the calls that they're getting in. And what we're seeing is the highest calls are coming in from Polk, followed by Hillsborough, and then Miami-Dade. These also include the age distribution. So unlike the other slides, this age distribution here, we're seeing much more for the adult population. So looking at the 30s. So really, if you counted the 20s to 40s, you've got the majority of the calls being for that age category here. And so that kind of gets us to that next piece of, so we just shared with you what stimulants are. What does that look like for the overamping? What are the things to the signs and symptoms? What are the long-term effects for use across these various different substances that are in the stimulant category? And then we talked to you a little bit about, well, what does this look like for Florida? What is it look like across as a state as a whole, and then across our different counties and regions, to be able to understand, okay, well, how should this then drive what do we do next? So with that, Major Coy, I'll turn this part to you to get us kicked off on the conversation about, well, what are we going to do?
Absolutely. Thank you so much, Kathleen. Very, very intricate information on all of the data that we have on all the different sources we have out there regarding stimulant use. Thank you so much for that. So if you have been through a SAPS course before, it used to be called the Substance Abuse Prevention Skills Training. It's now called the SPIF Application for Prevention Success Training. You've probably seen something kind of similar to this slide. It used to be called the Continuum of Care. It's now called the Spectrum of Mental, Emotional, and Behavioral Interventions. And basically, it's the full spectrum of what we can do about this, what we can do once you've identified a problem. And it really goes into, first talking about that primary prevention, talking about prevention, getting out in front of youth, getting out in front before that first real use has ever occurred, and preventing or delaying the first use of a substance or stimulant. And then it goes into a little bit more detail about, okay, now let's specifically hone down on overamping prevention. What can we specifically do in our community to prevent overamping of stimulants, and for that specific drug? It's a combination of getting out and talking about the primary prevention and delaying first use for all substances, and then getting more specific about the overamping prevention, while partnering with treatment and recovery providers and partners, and collaborating those efforts to have that unified message to try to prevent some of those negative impacts of using stimulants. If you want to get more detail specifically on the training I just talked about, both Kathleen and I are both master trainers for our state. We've got a great group of instructors. It's a 4-day course if you want to come and learn a little bit more about strategic planning and learning how to implement prevention strategies in your community. We would love to share that with you if you're interested in attending one of those courses. Next slide, please. Some of the prevention, the primary prevention efforts specifically to stimulants, is first just educating, creating an awareness campaign, making sure parents, making sure key leaders, making sure teachers, those that have direct access to our youth, and those that may have access to actually sitting down and talking with patients, doing information campaigns with doctors, letting them know some of the negative outcomes that can come along with the misuse of stimulants. So that education awareness campaign, that's number one. Next, we talk about this a lot within the GARD and CCA. We do a lot of safe storage and disposal presentations to increase the awareness and the importance of storing medication that could potentially be misused or diverted in an illegal manner, storing that in a secure, whether it's a lockbox or whether it's a safe in the house, or there's so many different methods out there now, and we've partnered with a couple of organizations to promote different packaging that can help you safely store medication, so it's not again diverted. And then also not just storing it safely, but also once you're done with it, once it's expired, once it's you no longer need it anymore, disposing of that properly. So there, and again, there's so many different ways to do it. It's not flushing it down the toilet, which is a common misconception that we talk about a lot. Disposing it properly, using items like DisposeRx or Deterra, or there's so many different ways to safely and securely dispose of that medication to get it off the shelf. And then finally, one of those disposal ways is the DEA medication take back days. Those typically happen the fourth Saturday in October and the fourth Saturday in April. So we just had one here recently. So the next one will be coming up in April. It's a good opportunity if you are a local nonprofit, or if you are a drug prevention coalition or a task force or an organization, or you can partner with law enforcement or college campuses. There's so many different ways to participate in the DEA Take Back Days, and it's just another way to get that stuff off the shelves when those medications or those stimulants are expired or no longer needed. All right, and now Kathleen is going to talk a little bit about specifically overamping prevention.
Awesome. Thank you so much, Major Koya. And like I said, the piece for the prevention, which is so nice, is it really covers for no matter where you are in the continuum of care. It's for the greater understanding at the community level and finding ways for that engagement process. So this slide here, we're talking about the overamping. Again, we're trying to avoid the use of just overdose as it gets tied so closely to opioid use and Narcan being that direct initial piece. As we mentioned multiple times now, still always use the naloxone just in case. Since we see so much of the substances today with fentanyl included in there, whether intentional or not intentional, it's still a concern. So what we can do with the overamping prevention as one is providing that education and awareness. Just being able to talk about what are those short-term, long-term effects. What does it mean by stimulant use? We talked about here at the beginning, stimulants are found in all different kinds of things, including things like that we use on a regular basis, like foods and coffee and energy drinks, all of those different things. But then it's the excess and when the consumption turns into those negative effects that happen, whether it is in the short term or long term. Just the awareness piece of what to look out for, what to be aware of. The other part too is that as you saw through the description of what do those signs and symptoms look like of those negative effects, a lot has to do with the things related to the blood pressure, heart rate. There's a lot of concerns with cardiac arrest. So one of the things that is really important to put out there is ensuring that we have proper health checkups. So if we are talking about individuals that use substances, that giving that awareness of the importance of making sure that they're doing health checks to ensure that they're looking at their blood pressures, to ensure that they're getting those checked up, because those are kinds of the things that will end up with turning into something fatal. Being able to talk with your physician in healthcare, whether it is a prescription medication that you're taking or whether it is other kinds of substances that you are consuming, having that conversation is really important because they can give you some of the information needed to be able to better take care of yourself. And then another big piece is avoiding the mixture. So there are counter interactions for different substances. So when you have different types of stimulants, which are uppers, and then combining it with something that's a downer, like the Xanax, it makes for not a very good combination. Mixing it in with alcohol, the stimulant and then alcohol together, which we do see, especially around some of the drinks with Red Bull and those, they can have a very negative effect about on the individual. So increasing that education awareness, making sure that we're having the conversations about self-care and getting checkups and making sure that they see that there are multiple ways that overamping can look like. That includes the physical piece, but it also has the psychological side. So making sure that we're also keeping a check on those pieces because it's not just one thing and it looks very different for different individuals. And it also depends on the type of substance and then also what else was mixed with your substance. So avoiding the mixtures, having open conversations, increasing the awareness and trying to remove that stigma so that we can have open and honest conversations to connect individuals to the services, to the supports, to the resources that are available, because we do have a lot of resources. And again, I want to stress this again, if you feel that somebody is having an overdose and overamping, whatever you think it might be, still use that naloxone. It still has a much better chance to reverse in case there is an opioid in there, but there isn't a downside to it. So we definitely want to make sure about that. Which then brings us into that treatment and recovery conversation. So really important into that treatment piece is that it's a little bit different than what we see with like an opioid use disorder. Stimulant use disorder has so many different components to it, as we saw through some of those various types of signs and symptoms. But there are a couple of things that have been identified as best practices or promising practices or those evidence-based approaches. The first being the cognitive behavioral therapy. This helps to aim at modifying an individual's thoughts and behaviors in order to reduce stimulant use. It's been found to be effective across a lot of different studies that have been done as a way of treating stimulant use disorder. We did include in one of the citations towards the end of the slides a study that did an analysis across multiple different studies. So it really gives you that full meta-analysis of what we're seeing. So you get that look that has identified what are those outcomes as a result of these types of approaches. So cognitive behavioral therapy being one of them. The one that was noted as one of the most effective has been the contingency management, which is a way to use incentives and motivation, kind of that positive reinforcements approach, which we do have a lot of understanding on the prevention side as a way of encouraging and working with young people. But this approach has been found to be very beneficial in how to work with individuals that are struggling with stimulant use disorder. So this is a way in which you can look at some of those reward incentives for achieving different, whatever those outcomes are set up with your treatment provider. The downside for what is available for stimulant, unlike the opioid use disorder, there's still a lot of unanswered questions when it comes to medication-assisted treatment for this. There are some studies that have been done that have found some mixed results, some that are finding some possibly promising results, but it isn't as clear cut as we see with like the opioid use disorder, which is why some of these other options have been identified based on the research that has been done as being effective in working with individuals that are struggling with stimulant use disorder. Another big piece that was noted in the research is the use of therapeutic communities, so sober living housing. That has been a very big piece, and which we see a lot also with other types of substance use disorders, because what that does is it provides an atmosphere and support system in place to be able to encourage and assist the individual all throughout. Looking at the research around sober living and recovery housing, we find that the research notes that these types of venues and locations and support systems provide what is considered the social capital to help really improve the outcomes of individuals that are moving through the recovery process. These options provide a unique opportunity to assist individuals in all the various phases. As we know, treatment and recovery is not just, there's not just one answer to support it. You've got a lot of different things that you're putting in, from the treatment itself, but then also the support services that get combined in there. With these sober living and recovery housing, what you find is that you get a support network. You oftentimes get to interact with peers with lived experiences. You have trained recovery housing staff, connections to the clinical side with the treatment partners, and then you also have access to the resources within your community. So this allows a lot of those pieces needed for that recovery process to be effective for individuals. And then the last piece we really want to emphasize here is the community-based recovery groups. So recovery community organizations have really evolved so much over the last few years here in our state. We've seen the positive impact on our communities because of that resource coming in, because what that does is it connects individuals that are seeking support or just seeking some kind of connection with individuals that have that lived experience and understanding. for what is it that they're going through and struggling with, and how to get those various connections to the resources. Because when it comes to treatment, it's not one piece is dealing with the substance use disorder. The other pieces oftentimes come with the connection for housing, the connection for employment, the connection for um, uh, all those other pieces that have an influence on someone's substance use. So being able to have those all together is really critical for the recovery process and treatment as well. Now, there is some work in progress, and so we did want to mention that. So while there isn't the same kind of emphasis for medication-assisted treatment as we see for like opioid use disorder, it's really important to note that there is still research happening to look at ways in which medication-assisted treatment can be utilized for individuals that are struggling with stimulant use disorder. And so these studies are, some of them are finding some positive outcomes, but there's still not a consensus out there for this as an option. But there are some promising findings that are happening, and we have included some of that information in our citations at the end of this. If you want to go into a little bit more of that detail, our focus here today was more to give kind of that big picture overview and some information around this, to then you can explore some additional pieces. The other piece we wanted to put in here is something that is quite interesting and unique that has been happening over time. It's not just now, but it has been around for a little bit, a lot of information around what we're seeing for possible ways to help individuals that are struggling with the cocaine use. And that is the introduction of a cocaine vaccine. While there is still a lot of research that is needed in order to see what this long-term effect is, there is a lot of promise for treating addiction with this cocaine vaccine that has been put on. Over the last couple of years, we've seen a lot more of studies being done around this. We have the National Institute on Health has provided some information around this of what is happening. However, there's still not a confirmed consensus that this is the way in which individuals can be able to move past that. However, it is a work in progress, so we did want to note it here as something to keep an eye out and hear. And I know many of the treatment providers across our state have worked with a lot of individuals and are finding what they're seeing as promising and helpful practices to working with individuals that are struggling with stimulant use disorder. And I see we've got a couple of comments here in the chat, so let me see if I can get through some of these so we can make sure we're answering all the questions. Trying to get to where the first one is going. Okay, so we see here. I'm wondering about individuals with dual diagnosis as they're eligible for therapeutic communities. Well, a lot of that depends on what is available for those services and supports. Some places are equipped with being able to offer treatment and support and recovery support for whatever dual diagnosis. Not every provider has it set up to deal with both a substance use and mental health, but some do. However, they do oftentimes have working relationships with other organizations that can bring in the support for the mental health side. But it just depends on where you are and which provider you're looking at. Let's see, we have here, so that there's a Right Life in Okeechobee has a recovery and an amazing resource. So Jessica, thank you so much for sharing about that. It's always good to know about what else is available out in our community. Lisa put that depends on the sober living housing. Often there are specific options for dual diagnosis. So yes, again, it very much depends on the provider and housing group that you're working with and what available resources and is available for that area. Any idea when this will become a treatment option? Unfortunately, no. That's the downside about when things are still in their research form and there's still a lot of unanswered questions. And it also makes it even more challenging that when we talk about stimulant use disorder, we have so many different types of substances that are included in what a stimulant is. And as you saw with some of the descriptions about some of the effects of them, short term and long term, some of those things can vary. And then also looking at whether there are physical things that are showing up or if there are psychological things showing up, it makes it that much more challenging to figure out what exactly can connect that medication assisted treatment for what's happening. So unfortunately, the answer is not quite that simple, but our hope is that the research will continue to grow and be able to bring in some more perspective on what can help. The plus side, there are a number of different resources out there. I encourage you to find who your local recovery community organization is in your area, to also find and see about what are the other resources and supports. And key to a lot of this also is to identify and find who is your local community coalition, as they have a lot of the data that they collect to understand what's happening in your local community and be able to help use that to guide what are some of the strategies, messaging, resources, services that your community is in need of. So we hope that this information has been helpful to all of you on understanding what stimulants are, what does that look like, what overramping is, why it is also important for the inclusion of naloxone as something that you still have available, even if you know they took a stimulant, because there is so much out there right now that we're seeing with fentanyl being across all the different types of substances out there. But if you have any questions, we do encourage you to please reach out to us. We've included our information. Oh, apparently I included my old email address. I apologize for that. I will put my updated email address in here. I don't know how I missed that one. So we will send that in there. So I included that in the chat. So that's my email address. We've included the resources here as well. So everything that we referenced in here is available. We included the links for things that you can get online. And so it makes it easier to find this. You don't have to just Google search everything. But all of those references are in there for everything that was included, the data, the definitions, the description, and also the research-informed approaches to treatment and recovery, the prevention and overramping prevention. We hope that you'll be able to use this information in the work that you do, and we want to thank the Department of Children and Families for allowing us to be a part of this webinar here today. We also want to thank Florida Alcohol and Drug Abuse Association for this opportunity and allowing us to share this with all of you. And Robert, with that, I think, Major Coy, anything else you want to share before we give it back to Robert?
Nope, just thank you all so much for being here, and I look forward to having another training with you in the future.
Awesome.
Well, thank you so much, Kathleen and Major Coy, for all the work you put into this webinar and all the valuable information you shared with us today. For those of you, I would like to once again put the slides in the chat box. And what that is for these references you have seen on your screen. If you open up that PDF, you will be able to access the hyperlinks for the references that were used in today's presentation. So please note a couple of business items before we conclude today. First and foremost, I am putting the link to the evaluation in the chat box. When I end the webinar here in a few moments, your web browser will come up and redirect you to the evaluation as well. So please don't close out of that. Please make sure you go ahead and complete that. I have also included as well, I know Kathleen just shared this, but Kathleen and Major Coy's contact information is here on the screen. You will be prompted to sign into or register for an account to complete the evaluation at the end of the webinar. You can register as a visitor at no cost. Please ensure that your name and email address match the name and email address you provided when registering for this webinar. For CEs to be reported to CE Broker, for Florida licensed healthcare practitioners, you must provide an accurate Florida Department of Health license, prefix, and number the first time you register. After you register or sign in, you will be directed to the evaluation. Again, please remember to use the same email address for the evaluation that you used when you registered for today's webinar. This is the only way we can connect your attendance to your survey completion. If you experience any difficulty logging into your account or accessing the survey, you can contact us at FATA either by filling out a contact form on our website as shown on the screen, or by sending an email to training@FloridaBHA before the evaluation closes on November 13th. We do not email statements of credit. Instead, after we verify your attendance and the completion of the evaluation, a statement of credit will be generated as a journal entry within your profile 30 business days after the evaluation closes. As a reminder, the recording and materials used in today's presentation will be available on the FATA website within 30 business days. To access the recording and PowerPoint, visit www.fata.org and navigate to the Resource Center, then click on Training Library. Thank you all for participating in today's webinar. Once again, thank you, Major Coy. Thank you, Kathleen, for your time. We'd also like to recognize and thank the Florida Department of Children and Families for funding today's education. Have a great day, everyone, and please hold for the evaluation.